This is a special edition of Focus, Insights on the Southern University Ag Center.
The Omicron subvariant, BA.5, now the most dominant strain.
It still is in your benefit to become vaccinated.
In the news lately, monkeypox.
Monkeypox is not a new disease.
We have a problem, Louisiana.
COVID-19 brought the world to a screeching halt in 2020. Since then, we've gone through many variants and subvariants of this virus, some more transmissible than others. The world is now dealing with the Omicron subvariant BA.5. We have with us today Dr. Joseph Cantor, Louisiana's State Health Officer. Dr. Cantor, we're so glad you could join us today. How are you doing?
I'm doing good. The pleasure is all mine. Thank you for having me.
Dr. Cantor, last year we spoke approximately around the same time, and we were dealing with the Delta variant. And now a year later, we have the Omicron subvariant BA.5. It's being transmitted. What is COVID-19 Omicron subvariant BA.5, and how does it differ from previous COVID variants?
Well, it's got a lot more similarities than it has differences. The nature of a virus like COVID is it's constantly mutating. It's never the same virus. And some of these mutations end up not being terribly significant, and some end up being significant. Every now and then you have a mutation that just becomes much more transmissible, much more infectious, much more easily spread than the variant that preceded it. And that's where we find ourselves now. So BA.5 is a subvariant of Omicron, which is a subvariant of the initial COVID strand. We're all talking about variants of variants, just mutated virus that retains the bulk of the same virus, but with some tweaks. These tweaks have made the BA.5 variant more transmissible, so it's easier to spread. And for people that had COVID in the past or had been vaccinated, while that protection still averts against the chance of having severe disease, we are seeing a lot of reinfections, half of that, because this variant is so transmissible and can evade a little bit of the immune system. That said, the illness that it's causing people is not terribly different. If anything, it's more mild. So as opposed to earlier in the COVID outbreak, when we were overwhelming our hospitals, we're not seeing a lot of people with severe illness. And that's a good thing. We are seeing a lot of infections, and we're in the middle of a surge right now, a very big surge. There's a lot of COVID being spread. But thankfully, the sickness people are getting is more mild, and we're not at risk of overwhelming our hospitals the way that we were at earlier points of this pandemic.
Oh, that's good to hear, Dr. Cantor. Well, do current vaccines and treatments, do they protect against severe disease and hospitalizations and deaths from the BA.5 subvariant? And should we all have the second booster to combat this variant?
Yeah, they do. And they particularly protect against what we really want them to, which is severe disease. And even with the immune evasion we're seeing with the BA.5, meaning even with the reinfections we're seeing with it, it still provides, the vaccines still provide good protection against severe disease, against your chance of being hospitalized or your chance of dying because of this virus. And at the end of the day, that's the most important thing. So for people who have not been vaccinated, it still is in your benefit to become vaccinated, even if you've already had COVID. It adds to your protection. For people who are vaccinated but not yet boosted, it is in your benefit to get boosted. And if you're 50 and above, or if you have a condition that causes you to be immunosuppressed, it's in your benefit to get a second booster right now.
Okay. What are some signs or some symptoms of the BA.5 subvariant?
You know, in a lot of regards, they're indistinguishable from earlier types of COVID. Upper respiratory infections like sinus infection, runny nose, cough, malaise, fever, flu-like symptoms, feeling like you have the flu or getting the flu, lethargy, being tired, all the symptoms that we've saw with earlier COVID, including loss of taste and smell, you can see with BA.5. They really are no different than they were with earlier types of COVID. What is a little bit different is the chance that you're going to be hospitalized or die with BA.5 is less. But the symptoms of getting it are about the same as they were with other types of COVID.
The at-home tests, do they detect the BA.5 subvariant, Dr. Cantor?
No, they do. If you have BA.5, you'll be positive on a home test. Now, one of the things we have to talk about is when you have COVID, you rarely ever know precisely what variant you have. These tests, whether you're getting tested at home or a standard test in a hospital or a send out test, it's either positive for COVID or it's negative for COVID. And all of these variants, if you have that variant, will make that test COVID. You rarely ever know if you have BA.5 or BA.4 or whatever it is. And at the end of the day, for you personally, if you do have COVID, it doesn't really make it much of a difference. The treatment is the same regardless of what variant it ends up being. Your chances of how long you're going to be infectious, they're roughly the same too. So not much is riding on a personal level on what type of variant you have if you have COVID. It makes a big deal of importance on the population level because it allows us to track where this pandemic is going and try and make predictions. I'll tell you right now, about 80% of all new cases of COVID are estimated to be the BA.5 variant. But if it's you who gets positive with COVID, it doesn't really make a difference what variant it is right now. The treatment is all the same.
Now, are people staying positive longer, or is the incubation period changing due to BA.5 subvariant?
No, not significantly. Not significantly. We still see people get positive, on average a couple of days after being exposed. And it's possible to remain contagious for up to 10 days, really. And what we're advising people to do, if you are positive, is isolate for at least 5 days. At least 5 days, stay home, and then you can test. And if you're negative, you should be good to go. Or at 5 days, you can come back and wear a mask, a well-fitting mask for the next 5 days. That's the safest thing to do so that you don't put those around you at risk.
Dr. Cantor, as far as eating at a buffet, I had someone wanted to invite me out to eat at one of your local buffets, and I turned it down just recently due to this subvariant being transmissible. What is your take on something like that, on going out to eat at a buffet style restaurant?
Well, I'll tell you, it's a great question. The fact that it's a buffet doesn't move me one way or the other. The real risk is being in indoor crowded spaces right now. When you're in an indoor crowded space, like a restaurant, if it's crowded, certainly a bar, a concert, a meeting, those are high risk environments for transmission. You can greatly reduce your own risk if you wear a high quality mask, particularly an N95 or a KN95. And those are pretty easy to get now. The fact that it's a buffet doesn't really add a lot of risk unless people are really congregating in the buffet line. If they're really close together in the buffet line, the risk is from those people. I'm not particularly worried about a risk from the food or from the silverware, used for the buffet. It's really just an issue of how close people are together in an indoor environment. So whether it's a buffet, a restaurant, or anything else, a lot of people close together in an indoor space is going to increase your risk.
Thank you for that, Dr. Cantor. And what should we expect in the weeks ahead?
We've been surging for 2.5 months now, which puts us on track for this to be the longest duration surge that we've had. It's not the most consequential surge because we're thankfully not filling up our hospitals the way we were before, but it's a surge of very long duration for us. I think we're going to peak soon, just based on the timing. And so I think we can expect to peak relatively soon and then have cases slowly go back down, have a lull, and then we'll likely have more surges in the future. COVID is not going to be eradicated, unfortunately, as much as we wished it would. COVID is going to be something that we live with. COVID is going to be something that we learn to mitigate. And I hope that with each successive surge, it's something that disrupts our lives less. In earlier surges, they were highly disruptive to our lives, and they were associated with mitigation measures and orders and that sort of thing. Thankfully, that's not necessary now because the clinical acuity is more mild. So many more people have been vaccinated, have been infected before, and we have good treatments now. So all those things combine to make these surges something that we can manage, like we're doing right now during this surge. And I think that unfortunately we'll probably have more surges. That's just the nature of COVID right now. It's not going to go away. It's going to be something that we're going to continue to live with and learn how to manage without having it really disrupt our lives.
Dr. Cantor, as far as vaccinations, um, with COVID, the subvariants, is it because of people being unvaccinated that this virus mutates into something else? Is that the reason
No,
being? Not necessarily. Okay.
it's tough to say. The amount of people who are unvaccinated doesn't help, but a virus like this just tends to mutate. That's the natural course of the disease. I'll tell you, one of the things that gives me confidence in this is about 95% of the state of Louisiana at this point in time has either been vaccinated or infected with COVID in the past, or both. 95%. And while that's not 100% protective, it certainly is significant. And I think that's one of the reasons why this particular variant and this particular surge is not causing us the type of problems that we had at earlier points in the pandemic.
Don't go anywhere. Monkeypox infections continue to rise in Louisiana. We'll have more on that when we return on this special edition of Focus, Insights on the Southern University Ag Center.
This virus may be around all year long, all the time. That's what it's done to us so far. And we could expect it to stay with us. So our really only hope is that vaccine.
Now that COVID-19 vaccines are available, it's critical that all of us get it. We won't get through this unless everyone takes part.
The vaccine is fine. I've got mine. Now it's time to get yours.
It's a team effort, so let's play fair. If we all pull together, it's a win-win for us all. The World Health Organization declared monkeypox a global emergency. Fear not, because monkeypox is not a new disease. There are vaccines available.
We have with us today Dr. Joseph Cantor, Louisiana's State Health Officer. He's going to shed some light on this for us. And Dr. Cantor, how are you doing today?
I'm doing good. Thank you for having me back. I appreciate it.
Okay, glad you could be with us. Dr. Cantor, we'll get right into it. What is monkeypox and how does it spread?
Well, monkeypox is nothing new. It's a virus that we've known about since the 1970s. And we've had some isolated outbreaks of monkeypox in this country in the past. One outbreak that comes to mind was in 2003, and it was connected to some prairie dogs that were imported from Africa and were infected and caused some infections to in humans. And that spread through a handful of states. These isolated outbreaks we were able to contain in the past. This outbreak has grown much larger than any of these prior outbreaks have. That's the bad news. The good news is that we know about monkeypox. We don't have to invent the wheel again on this. It's not like COVID where everything's new and we have to develop new medicines and vaccines. We already have treatments for monkeypox. We already have vaccines for monkeypox. And we know a great deal about how it spreads. This particular outbreak, the dominant mode of transmission is person-to-person close contact. Oftentimes, it's been in a sexual nature, although it doesn't have to be. It's not actually an STD, but in the current outbreak, it's been spread through sexual contact because there's been close contact in that environment. But it doesn't have to be spread that way. It can be spread through close contact of any way, human-to-human, actual close contact, particularly if you touch or rub up on someone else's lesion. It can technically be spread through the air, through respiratory means, but I'll tell you that's not the dominant way it's spreading. The dominant way it's spreading right now is through person-to-person contact.
What are some symptoms of monkeypox and what should someone do if they are exposed or have monkeypox symptoms?
Classically, people will first get what's called a viral prodrome, meaning they get a little fever, a little malaise, flu-like symptoms. They feel like they're getting a flu, and then a couple days later, they start finding these rashes or lesions on their body, and they can be very small, 1 to 2 centimeters, raised, oftentimes tender, and they can show up on any part of the body, really. If you were to Google monkeypox, you'll find these pictures of kids covered in lesions. That's not what a lot of people are presenting like. A lot of people are having lesions in just one part of the body, whether it's the arm or the face or the genital region. Some people don't even get the fever or malaise first. Some people just get the rash, and that's that. That's typically how these things spread and how they look. One thing to know, we've not yet had any fatalities from this monkeypox outbreak in the US or, as far as I know, in Europe either. In some other countries that don't have terribly developed healthcare systems, you can have fatalities. But with a good healthcare system like we have in the US and Europe, so far there's been no fatalities and people have recovered well from this illness.
The World Health Organization has declared monkeypox a global emergency. What does this mean for us in the United States?
To me, it signifies that we have a window of opportunity to make a difference right now. This is spreading, but it's not yet everywhere. So we have a chance to really lean in on this outbreak and employ the public health tools that we know so well to contain this outbreak and try and keep it from becoming something that spreads further or something that's with us for a long time or even forever. The way we do that is through classic public health measures, contact tracing, so we can identify who's exposed to positive cases, giving people what's called post-exposure prophylaxis, which if you catch someone within 14 days of being exposed, you can give them, that's enough time to give them the vaccine actually, and that can help either prevent them getting infected from that exposure, or if they do get infected, have them have less severe symptoms on that. And then providing vaccine to people who are at risk in the general community. That's what we're working on right now. And I think if we use those tools, we have a good chance of containing this thing before it spreads to even more people.
So there are vaccines available and anyone can get the vaccine if contracting monkeypox. That is correct.
There are vaccines available. The challenge is they're in very short supply right now. So the best vaccine available is one called Jynneos. Unfortunately, there's just not a lot of it going around. As of last week, the CDC only had 75,000 doses for the whole country. They're getting more shipped in. But when that gets divvied up across the country, it's just not enough, really. So, for example, so far in Louisiana, we've been allocated only 2,000 doses of the vaccine, which doesn't scratch the surface of what our need is. What we would like to be able to do is to offer the vaccine to anyone who's really at risk for this. And right now, that risk population really is men who have sex with men, and particularly those who have had multiple or anonymous sexual partners in the past 14 days. That's the risk population right now. And we would like to be able to offer a vaccine to anyone in that population who wants it. We're in the process of advocating to the CDC to get more, but we haven't really gotten more yet. We're hopeful we will.
Dr. Cantor, what should we expect in the weeks ahead dealing with monkeypox?
So I would expect, number one, that we'll get allocated more vaccine from the CDC, and then we'll be able to spread that out amongst the state of Louisiana and make it available more to those people who are at risk, particularly men who have sex with men, and particularly those who have had multiple or anonymous sexual contacts in the past 14 days. That's number one. Number two, as testing becomes more available, and it's much easier to test for monkeypox now than it was even a couple of weeks ago, I think we should expect more people to get tested, and we'll see the case count go up. Right now, there's about 3,500 cases in the US, of which 28 are here in Louisiana, but that's only the cases that we know about. The cases that have been tested and formally diagnosed, I'm willing to bet there's more cases out there that we just haven't found. So I expect those numbers to go up over the next couple of weeks, and I expect we'll thankfully have more vaccine to be able to make available to the people of the state.
And that's going to do it for us today, Dr. Cantor. And we thank you for taking time out to be with us here at the Southern University Ag Center.
Thank you. The pleasure is all mine.
This has been a special edition of Focus, Insights on the Southern University Ag Center.
The Omicron subvariant, BA5, now the most dominant strain.
It still is in your benefit to become vaccinated.
In the news lately, monkeypox.
Monkeypox is not a new disease.
We have a problem, Louisiana.
This virus may be around all year long, all the time. That's what it's done to us so far. And we could expect it to stay with us. So our really only hope is that vaccine.
Now that COVID-19 vaccines are available, it's critical that all of us get it. We won't get through this unless everyone takes part.
The vaccine is fine. I've got mine. Now it's time to get yours.
It's a team effort, so let's play fair. If we all pull together, it's a win-win for us all.